quadriceps muscle group.
It's right in here.
Suprapatella bursa.
It's like 2 fingers above, so it's right in here.
Patella.
It's right here.
Patellar articular surfaces.
So if you move it medially, it's underneath here, and laterally, it's underneath here.
Femoral trochlea, or femoral condyles.
That's like right in here.
Patellar tendon.
It is right in here.
Subcutaneous bursa.
It's between the skin and the patellar tendon.
Deep infrapatella bursa.
That's below the patellar tendon.
Tibial tuberosity.
That is like right in here.
Fat pads.
Those are on the sides of the patellar tendon.
Retinaculum.
Those go on the sides of the knee, right in here.
Synovial plica.
Those go more towards the center, around the patella more.
Pes anserine tendon and bursa.
Just medial to the tibial tuberosity, so it's right here. And then the bursa is underneath the skin, but above the above the tendon. And yeah, that's it. Now I'm going to measure the patient's Q angle. So I'm going to have them supine. The fulcrum is on the middle of the patella. The stationary arm is over the ASIS, or in line with the ASIS, which is right there. And then the movement arm is over the tibial tuberosity, which is right in here. So that is about 16, which is okay, because in women it has to be less than 18, and in men it has to be less than 13. Now I'm going to move on to my patellar glide tests. I'm going to have a bolster under here to keep the knee at like 30 degrees of flexion. So first what I'm going to do is the medial patellar glide. So I'm going to be on the lateral side, pushing with the patella medially. It should move about half its width. Positive test would be hypermobility or hypomobility. So hypermobile would indicate that it's going too far, and that would be laxity of the lateral restraints. And if it's hypomobile, it's not moving enough, so that could indicate tightness of the lateral retinaculum or the IT band. So I'm going to do the patellar glide laterally. So it should move about half its width again. If it is positive, that could indicate that it's moving hypermobile or hypomobile. So if it's hypermobile, it's moving too much. If it's hypomobile, it's moving too little. Hypermobile means that the medial restraints are lax, and if it is hypomobile, then the medial restraints are tight. Now I'm going to do the apprehension test. So I will have my patient supine, and for all of these tests, they will be bilaterally. I will compare them bilaterally. So I'm going to be on the medial side, and I'm going to just push laterally, and if the quads tighten up or the patient is apprehensive, that could indicate their possible fear of dislocation, and it could also indicate laxity of the medial retinaculum. The next one I'm going to do is Hodgkin's plica. So I am going to be on the lateral side. Their knee will be flexed to 90 degrees. My hand will be up here, one hand internally rotating the tibia, and I'm going to be pushing the knee or the patella medially and feeling if there's any symptoms, or if I feel the medial plica, as it passes over the medial femoral condyle, that could indicate symptoms of medial synovial plica. The next one I'm going to do is I'm going to have them off the end of the table for the Sutter test. So I'm going to lightly cup over the patella, and I'm going to have my patient extend and flex their knee. And I'm feeling for the way the patella moves, and if there's irregular motion or it stutters, that could indicate a synovial plica, and it should make a J shape normally. And the last one is Clark's sign, so I'm going to have the patient be supine, and I'm going to put my hand in the web space, and I'm going to have them contract. And if the contraction is painful or they can't hold it for long, then it could indicate chondromalacia patella, which has to do with the cartilage. And that's it.